Let me ask you something. Have you ever felt that leadership is more about chasing numbers than helping people? Hey, I'm Dr. Jeff, and I'm here to talk about that sometimes we need to go beyond the metrics. Merciful leadership can take you beyond the metrics to the people, which is so crucial in what we do every day. I'm getting tired of hearing about the metrics all the time. Now, don't take me wrong, I know results are very important, and metrics are crucial to propel our organizations forward. But where do we find the balance of achieving the metrics as well as taking care of the people? So I want to talk to you about, just for the next few minutes, about leadership and going beyond the metrics. There are times in our careers that we need to focus on the people and recognize that the people help us achieve the metrics. Throughout my career in healthcare, which has expanded over 30 years, I have been serving under different types of leaders. Some leaders that I've been exposed to have had a sharp focus on the metrics, and that's okay. But then their focus is so sharp on the metrics, they lose sight of taking care of the people who help us achieve the metrics. And especially in healthcare. So no matter what industry you're in, a service industry, we have to recognize it's about the people. But in addition to healthcare, where I've spent my entire career, I've recognized that we must have empathy and caring relationships with the people that we serve. So think about that pain problem that you've had. Maybe it's staffing issues, multiple call-ins in the middle of the night. And I'll tell you this experience I had. When I first became a chief nursing officer several years ago, I was working all day long and we had 4 call-ins on the night shift. We were trying to figure out what could we do to ensure that our patients were safe and that they were well taken care of. Even though I had worked all day long, I decided that it was time for me as a leader to be there with the people that I serve, and I became that nurse. I had never charted at that hospital on that specific type of documentation, and I must be transparent with you, it was even before electronic documentation, so it was all paper. In that paper documentation, I had 6 patients that I had to take care of. We were running without a charge nurse as we were all just chipping in, and I worked the entire night shift. It was about 4 a.m. and I looked down at my documentation and I was thinking, my goodness, what did I just write? Because it did not even make sense. However, the people that I was serving with, my staff, they came around me to make sure that I didn't need anything that entire night. They supported me as I supported them. It was a strong realization at that point because it was early on in my CNO career that I recognized that if I take care of the people that I serve, most of them will work to help take care of me and ensure that our hospital achieved great results. And the hospital did achieve great results. We were recognized for the quality of care that was being provided. We were recognized for the culture that we had. We were recognized for the safety that we had. There were many things that we were able to achieve wonderful and great results, but it was because we were taking care of the people that we served. So we can't lose sight that it is going beyond the metrics. The metrics are crucial and the metrics are important. However, we have to develop relationships with the people that we serve. Another thing that I want to talk about is really, what does merciful leadership look like in a metrics-driven world? So the first thing, and I want to break it down for you in about 3 or 4 quick, simple steps, is that the metrics are important, but we must first have presence over pressure. When we're trying to achieve results as a leader and we're searching of how do we best influence other people, our presence sometimes is what's required. Yes, it's easy to bark orders. Yes, it's easy to give commands. Yes, it's easy to expect that when we say something, somebody must move and react. And I guess there's some truth in that. But I think there's also additional truth that when we have presence over pressure, the presence will take us much further than what the pressure does. Anybody can respond to pressure, but a lot of times people will leave the organization because the type of pressure that we are applying, are giving, are forcing onto the people that we're serving. So we must have presence over pressure. We must take time to be visible in our organizations. It's crucial to the viability of our hospitals and other organizations that we are visible among the people. You know, I have found myself sometimes overwhelmed or maybe overcome with work, not necessarily overwhelmed, but overcome with work, that I'm so focused on all the calls that I had to be on, or reports that were needed, or deadlines that I had to meet. And there were times where I just had to step outside of my office because it had been a little while since I have been with the people that I was serving. And so I found it so important as something for self-care, is that when I went onto the floor where the caregivers were providing care, I was reinvigorated by being around the people that I serve. And I find that now in my current role, that when I travel to the hospitals that I support, I'm reinvigorated because I'm around the people that I serve and I see the wonderful things that are being done. And yes, my heart is still at the bedside and I see patients receiving great care. So it's crucial that we provide presence over pressure. When we are present with the staff, and then the pressure sometimes comes to fulfill the metrics that we must achieve, there is much more ownership from our staff because they have a relationship with us. And I can't stress that enough. The relationship is so important and it comes from our presence. Number two, it's people first, even when it's inconvenient. Do you know a lot of leaders walk away because they do not like confrontation, or they want things to always be convenient on their time? I want to encourage us today that it's not about us, it's actually about the people that we serve. If you work in a healthcare setting, it's about the patients that we serve, and it's about the families that we serve. And there are oftentimes a lot of inconvenience in leadership. I did not sign up for convenience in leadership. Can I get a witness here? Can you raise your hand and say, I agree with you, Dr. Jeff? Because there are many times when the phone calls come in the middle of the night, or we have conflict, or we have problems, or we have things that seemingly may drain us. They are inconvenient to what we truly want. But really, there are times where in the inconvenience that we provide so much more rewards to the people that we serve, and even internally in ourselves, we reap the rewards of that inconvenient time. What do you mean by that, Dr. Jeff? Sometimes through those hard conversations, we learn. In every experience that I have had in leadership, I can say I have probably learned a lesson from it through the convenience and oftentimes the inconvenience of the things that I'm doing. And then we must lead the metrics. Don't let them lead you. Sometimes we're so driven by the numbers that we see, we're letting that lead our decisions all the time. We're letting that drag us through, or maybe even bog us down as such a heavy weight as leaders. But we have to take charge that we lead the metrics. How do you lead the metrics? Go back to the relationships and the people. When we're establishing relationships and taking care of our people, we actually are leading the metrics, because it is something that I have seen throughout my career. The results come because people are engaged, and the culture is of such where they are willing to provide the best care for the patients because you as the leader, or I as the leader, are engaged with them and they're committed to the organization. So when I look at my career and I look at sometimes the turnover that's been in the hospital that I served, or the relationships that I've had with other people, I personally think about those important times where it's been crucial that through the relationships, I feel like people have been more committed in their roles, or I have seen that turnover has decreased when we are aligned as a leadership team with the same values, the same principles. We're all engaged, we're visiting days and night shift, and everything is not necessarily always going smooth, but we see the problems, we handle the problems, we provide solutions, and we work collaboratively with our team, which is so important. And when we're trying to achieve the metrics. However, we're not letting the metrics lead us. We're bringing the metrics along. Actually, maybe the metrics need to catch up with us because things are going great inside of the organization, and it's crucial in the things that we do by leading the metrics, bringing them along, because I will guarantee you that when you develop relationships with your staff and you take care of them in a positive manner, results will come. I have seen it time and time again that results come when I have worked diligently to ensure that I have relationships with the staff. Or when there is pressure, we all have pressure together and we are owners inside of our organizations and not just setting up rental space, but we're owning it, and collaboratively as a team, we work diligently to ensure that we are achieving those metrics, but they're coming along with us because we're putting all the pieces together of the relationship portion of what we should do as leaders, and I find that the metrics come. So what's our call to action here? Here's my challenge for you this week, is that we must find together, you and I, find one moment, just one, where we can lead in developing or nurturing relationships with others. What are you doing today to establish relationships with your team? And what am I doing, Dr. Jeff, today to establish relationships with my team? Do you find yourself just in your office working on the metrics and looking at the numbers and working hard to achieve those things? Or do you find that balance to where you are engaging with your staff, developing those relationships, leading the metrics and not letting them lead you so you can achieve the best results through those relationships? As we go through the next several weeks on my YouTube channel and other platforms of social media, I'm going to be spending time with you to just insert leadership knowledge that I have learned over the last several years and over my extensive career. So I'm here to serve you, and I'm here to collaborate with you and work together so we can all learn in this platform so we can better ourselves and we can also better our organization. So we can reduce our own burnout, so we can improve our retention, so we can improve our recruitment and all the other things that we face as a leader. Because I will tell you transparently, I have been through some of the same things that you're going through. I have been through burnout. I have been through times where there was increased turnover. I have been through times where there's a decrease in our recruitment or the inability to bring folks in. I have addressed issues within our hospital or my career that I know that you have addressed in your leadership career. So I just want to spend time with you together, and I want to give back to you of things that I have learned in my healthcare career. So as we serve together, Dr. Jeff.